Ever wondered what those pesky kidney stones really are? Kidney stones, or nephrolithiasis, are hard, crystalline mineral deposits that form within our kidneys. Picture a grain of sand, or even a marble in some instances. That's how small or large these stones can be. They're formed from certain minerals and salts present in your urine, such as calcium, oxalate, uric acid, and cysteine. When these substances crystallize and clump together, that's when a kidney stone is born. The exact cause can vary depending on the type of stone, but no matter their size or cause, kidney stones can be a real pain, literally, when they pass through the urinary tract. So remember, kidney stones are more than just tiny pebbles in your kidney. They are crystallized deposits that can cause quite a bit of discomfort. So, kidney stones are not just tiny pebbles in your kidney, they're crystallized deposits that can cause quite a bit of discomfort. How do you know if you might have a kidney stone? Well, common symptoms include severe back or abdominal pain, often radiating to the lower abdomen and groin. You might also notice your urine turning bloody or cloudy, and a frequent urge to urinate, which could be accompanied by pain. Now, if you're unlucky enough to experience these symptoms, you're likely dealing with one of 4 types of kidney stones. First up, we have calcium stones, the most common type, formed when calcium combines with other substances like oxalate. Then there are uric acid stones, formed from an excess of uric acid. Thirdly, struvite stones, which usually form after a urinary tract infection. And finally, cysteine stones, the rarest type that form in people with a genetic disorder that causes cysteine to leak from the kidneys into the urine. Different types of stones can cause different types of discomfort, but none of them are pleasant. So, if you suspect a kidney stone, seek immediate medical attention. How do healthcare professionals find out if you have kidney stones, and what do they do about it? Well, diagnosis often involves imaging tests like CT scans, ultrasounds, or X-rays, which allow doctors to visualize the stones. Urine tests can also be performed to analyze the stone's composition. Once diagnosed, treatment kicks in. The approach largely depends on the size, location, and type of the kidney stone. For small stones, doctors often recommend drinking plenty of fluids to help the stone pass naturally. Pain management might also be necessary to handle the discomfort. In some cases, medication can be prescribed to relax the ureters, which are the tubes that carry urine from your kidneys to your bladder. This can ease the passage of the stone. For larger stones, more intensive procedures might be required. These could include lithotripsy, a non-invasive shockwave therapy that breaks the stone into smaller pieces, or even surgical removal. Treatment options can vary, but the goal is to get those stones out of your system as quickly and painlessly as possible. Can you prevent kidney stones from forming? And what happens if they're not treated? Indeed, there are ways to prevent kidney stones. For starters, staying hydrated is key. Drinking plenty of fluids, especially water, dilutes the substances that can form stones. Also, reducing salt intake can lower the amount of calcium your kidneys need to filter, thus minimizing the risk of stones. Furthermore, limiting animal protein like red meat, poultry, eggs, and seafood can reduce uric acid levels, another common stone former. Lastly, avoiding foods high in oxalate, such as spinach, rhubarb, and almonds, can help prevent calcium oxalate stones. If left untreated, kidney stones can lead to unfortunate complications. These may include urinary tract infections or, in serious cases, blockages in the urinary tract that can cause severe pain or kidney damage. Prevention is the best medicine, but if you do end up with a kidney stone, it's crucial to get it treated to avoid potentially serious complications. Are you doomed to repeat the cycle once you've had a kidney stone? Not necessarily. It's true that some individuals are more susceptible to recurrent kidney stones, but it's not an inevitable fate. Recurring kidney stones can be a real challenge, but they're not insurmountable. The key to breaking the cycle is long-term management and implementing preventative measures, particularly if you're prone to consistent stone formation. This might involve specific dietary changes, like reducing your intake of salt and animal protein, or avoiding foods high in oxalates. Staying well hydrated is also crucial, as it helps dilute the substances that can form stones. Beyond lifestyle changes, it's important to have regular checkups with your healthcare professional. They can monitor your condition, adjust your treatment plan if necessary, and offer medical guidance tailored to your specific needs. With the right preventative measures and medical guidance, you can break the cycle of recurring kidney stones.